prepare for a bedside ECMO cannulation, you will start by pulling the bed out from the wall. Then grab the bedside table and set it at the foot of the bed. Remove excess pillows from the bed and derobe the patient. Grab bag 1 from drawer 1 in the ECMO cart for initial prep supplies. Clear your designated space for supplies. Then place 3 ChloraPrep wands, a table cover, and a split drape in designated space. Aseptically, start by using a CHG wand to sterilize from chest to lower abdomen. Scrub in a back and forth motion as shown. Then aseptically use a new CHG wand to sterilize right groin to mid-thigh as shown. And then finish with a third CHG wand sterilizing left groin to mid-thigh as shown. Once prepped with CHG, you cannot touch those areas since they are sterile. If they are touched, you must re-prep each site again. Start the draping process. Grab the split drape and don a black bouffant if you are the ECMO specialist and if you are manning the ECMO cart. The APP will don a blue bouffant. A non-sterile person will hand over split drape sterilely as shown to sterile assistant. Sterile assistant will place the drape over the patient's legs with the split end facing upwards. Once placed, pull out the drape from side to side. Remove the covering of the sticky side of the drape all the way across as shown. Spread out drape and overlap split drape with table drape with second sterile person. Then remove the covering of the sticky side of the top section of split drape as shown. Apply drape over lower abdomen and then remove final sticky coverings. Apply top part of drape to patient's upper abdomen. Patient's groin sites should be exposed in openings of split drape. OR towels can be used to alter the size of the openings from the split drape. Surgeons may want 3/4 drape to cover patient's chest and head. Table cover to set up the table for an ECMO cannulation. You will need to make sure to don the appropriate bouffant and mask. Non-sterile person will grab the table drape and hand over to the sterile person. Sterile person will place table drape on the bedside table and spread out horizontally initially. Once spread out horizontally, the sterile assistant will spread drape out vertically, ensuring table drape goes over the foot of the bed. Split drape will then overlap with table drape before proceeding to the next step. The non-sterile person will then begin to grab supplies from the ECMO cart and hand it over in a sterile manner. Start by grabbing sterile towels from drawer 1 of ECMO cart and hand over in sterile fashion. Grab 4x4 gauze from drawer 1 and hand over in a sterile fashion. Grab a probe cover from drawer 1 and hand it over sterilely. Next, in drawer 3, grab the following and hand over to sterile assistant. A micropuncture introducer set, an access kit, either an Avalon or a Biomedicus kit, a stiff guide wire set. In drawer 5, grab the following and hand over to sterile assistant. A bulb syringe, a bowl from drawer 1, and a bag of saline with a decanter. Pour saline into bowl. Note how APP prepares bulb syringe for ECMO cannulation. Then you will grab the following from drawer 4 and hand over to sterile assistant. A distal perfusion catheter, a male-to-male adapter, a 3-way stopcock, 24-inch monitoring line. Next, grab a 0 Ethibond multipack of sutures from drawer 6 and hand to sterile assistant. Lastly, grab the ECMO sterile tray from drawer 2 and hand it over to the sterile assistant. To prepare a cardio-help circuit for cannulation, wheel the prime circuit to a room and set it in the corner by the bedside table. Plug circuit into red outlet. Next, grab 3 of the 1-liter sterile water bottles and pour into the heater. Then turn on the heater and allow it to boot up. Ensure that heater tubing is open as shown here and place it to the side. Hit prime and allow heater to fully prime. During this time, you can go ahead and put the lid back on the heater. Once heater is finished priming, place it in standby. To hook up the heater to the oxygenator, turn the blue locking mechanism on the tubing to the right and then unhook each piece from the connector. And connect to the oxygenator with a pullback and then snap into place method. Tubing should be secure on oxy by verifying with a slight tug. Then open the locking mechanism to allow water to flow through the heater. Once tubing is open, hit run and verify there is no leaks as it flows into oxy. Next, connect the blender to the wall. Connect the green oxygen tubing into the wall, and then connect the yellow air tubing into the wall. Then connect the O2 tubing of blender to the oxygenator. Clamp all 4 Roberts clamps, ensure they are as tight as possible. Then when clamped, disconnect quick connections and attach ends of circuit together in 2 loops. ES will then clamp drainage and return lines. Then set RPMs to 1600 to prevent retrograde flow. ES should start removing the tape from the sterile box. When prompted by cannulating physician, take cover off sterile box and hand over to sterile field, and cannulating physician will make necessary clamps and cuts to the sterile end. As the provider is finishing wet-to-wet connections to connect cannulas to circuit, unclamp the venous and arterial lines as surgeon unclamps from cannula side. Then increase RPMs to goal flow. Make sure after you are on pump that you document initial and daily charge with initial setup numbers.